Now, I spend a good amount of time thinking about nature and nurture. And
Mhm.
I think about it a lot athletically because I see so many second generation athletes in the NFL and the NBA. In your research, what have you seen that alludes to nature and or nurture with people that have mental health issues and or drug problems? Are there any direct correlations to family history, economic circumstances, education level attained? Speak to that a bit.
So, yes, there is absolutely a direct correlation between all of those factors that you mentioned: education, the neighborhood and environment you grew up in, whether your parents or guardians are incarcerated, not incarcerated, whether they use drugs, didn't use drugs. Um, the environment plays a key role in addiction, mental health, and involvement in the criminal justice system. It is no doubt a mix of nature and nurture. So, biologically, we know that some people are more likely to develop the disease, the brain disease of addiction, than others. So some people biologically, genetically, they are more likely to become dependent on drugs, where other people biologically and genetically, in some essence, they seem like immune to becoming dependent on drugs. And what I mean by that, I'm not talking, there are some people that they develop a tolerance to drug use, meaning I used to drink 6 beers to get the buzz, to get the euphoria. Now I need 8, 10, 12 beers. I need more of the drug to get the desired effect. I used to use 3 Oxycontin to get high. Now I've developed a tolerance to get the same high. I need 6. Tolerance is a symptom of the brain disease of addiction. It's someone's brain, that their body, and certainly more complex than this, but that they've become dependent on drugs. There's other folks who they can use drugs and they can use 3 Oxycontin. And every time they use 3 Oxycontin, they get the euphoria, the high, the effect they're looking for. They never develop a tolerance, and 5 years have passed and they're still using 3. Now, don't get me wrong, they're using 3 Oxycontin. You can get arrested. You could still get an overdose and die. You could still have bad consequences. We know with certainty now that there's absolutely a biological component, genetic component, that some people are more predisposed to developing the disease of addiction, problematic drug use, as compared to others. Now, when it comes to nurturing can either exacerbate the problem or be a protective factor in the problem. Okay? So here would be one example. The earlier you use drugs, the younger you are, the more likely you are to develop a substance use disorder addiction later in life than if you start using drugs later. So if your first experience with drug, with getting drunk, getting high, is at 14, you are more likely to develop a problematic addiction later on in life as compared to someone who didn't get high or get drunk or use their first drug until the age of 18. So from a standpoint, we would say people are going to use drugs and alcohol. They are. I mean, it's always been part of our society. Our job is certainly to prevent it. And then our secondary job, if we can't prevent it, is to delay it. Meaning the later you start using drugs, the better off. Okay. So we know there's a genetic biological component, but there's also the societal component, or the nurturing component of your exposure to drugs. Some 14-year-olds aren't smoking marijuana because they just never seen it. Right? But if you grow up in an environment, whether it's your household where marijuana is readily available and other people use it, you may have access to it at a younger age. When it comes also to societal factors, we talk about, like in social work, and it's not just social work, but like social learning theory. What we witness and learn in our childhood and our developmental years, we will tend to model or mimic as we grow throughout life. And so if we grow up in an environment, again, whether it's a friend group, could be witnessing parents, neighborhoods, whatever the case may be, where drugs are readily available, where they're normalized, we see that as a normal experience. Hence, we're more likely to use drugs as we continue on in life. So there's definitely a nature and nurture component to it. And many factors are associated with it. We know that addiction, and not all, but most mental illnesses do not discriminate based on race. So whether you are white, black, brown, we do know that you are equally as likely to have an addiction. However, white patients, participants, are more likely to seek and receive treatment than African Americans. And that, while it may sound like a correlation with race, is more of an economic barrier. Right. What we know is that those that are more wealthy, that have more economic resources, are more likely to seek treatment for addiction and mental health as compared to those that have less economic resources. And we see that in my research in drug court. There's no doubt that we say, hey, in this program, 30% of African Americans graduated, 60% of white participants. So there's a disparity in graduation rates. And we say, okay, well, let's dig deep. Let's take a look at the white participants and compare them to the African American participants. And we see that white participants were more likely to have at least a high school diploma or higher. They had more they had more wealth. They had more family support. So there are so many factors associated with that nurture component of it. But yes, they are all correlated, meaning the more education you have, the more likely you are to be able to get treatment. The more wealth you have, the more likely you are to be able to get treatment. The later you're exposed to drugs, the less likely you are to develop an addiction throughout life. And then at the same time, some of these, like schizophrenia, for example, is for the most part biologically, it's inevitable. And what I mean is if you are predisposed to develop schizophrenia, right, there are many factors that can lead to early onset of schizophrenia, right? But you could have a great environment, a great nurturing environment. But if you're predisposed to have schizophrenia and develop symptoms, that will happen. Right. And no matter how great the nurturing environment is, it certainly can help with getting treatment and recovery for it, right? But there's some mental illnesses that are predisposed that if you're going to develop it, you're going to develop the symptoms.